Now, what I'm gonna kind of go through right now is homeostasis. So let's talk about homeostasis right here. What is homeostasis? Most of us have kind of heard of homeostasis before, right? Homeostasis is a maintenance of a relatively constant internal environment within the body. Values of variables fluctuate around a set point to establish a normal range of values. The set point is the ideal normal value of a variable. Now, what does that mean? All right, we can use scientific words like this, and it's really hard to understand. So let's talk about it and let's break it down what we mean by that. So easiest way to understand it is this. Have you guys ever noticed that when we spike fevers or when your kids spike fevers, it's usually not during the morning, usually not during the day, usually it's late at night, right? Or even better yet, even without being sick, how many times have you guys gone to bed and you feel warm, cozy? But when you wake up, right, you go to bed, you feel warm and cozy, you look at your thermostat says like 72 degrees. You go to bed, and then when you wake up at 8 in the morning, 9 in the morning, or even earlier, 7 in the morning, doesn't matter, right? When you wake up, you're cold. Why? Right? You look at the thermostat, it still says 72 degrees, but you feel cold. Here's the reason why, right? It's not because of the temperature externally, it's because of the temperature internally. What happens is this. When we have a normal body temperature of 98.6, it does not mean we're at 98.6 every minute of every hour of every day. What it means though is this. There are some times when we're a little bit warmer right before bed. All right, we get a little bit warmer towards the 98.8. As we get a little bit warmer, what do? We start to sweat a little bit. We start to throw off our covers when we're asleep. So then it cools us down. As it cools us down, when you wake up, you're at a colder point in your body temperature. As you're in a colder point in your body temperature, when you wake up, you feel much colder, even though the environment temperature hasn't changed. Now, this normal 98.6, that's your set point, right? That's what the body likes to be at. But it's almost impossible to stay at that set point continuously. So instead, when we move around, when we go to bed, we're at a high point right here, and then the body compensates, right? Your higher body temperature, we want to get a little bit lower now. So we start to sweat a little bit. We start to vasodilate our blood vessels next to our skin so we can radiate more heat away. So then we start to cool down a little bit. As we cool down too much, then we start to move back up, right? All those sweating stops. So then we can come back upwards. When we take the highs and the lows and we take the average, then the average will be at 98.6, right? The variable right here is our body temperature. The set point is a 98.6, right? Where we want to normally be at, right? But that 98.6 doesn't mean we stay at this continuously. We'll have up and down fluctuations. That up and down fluctuations, like when we get too hot, we sweat, we vasodilate our skin, and you start to cool off. Then you move this downwards, right? That kind of condition, when we go from a high point to a low point, is called negative feedback. Negative feedback counteracts a change in a given variable to help maintain homeostasis. Meaning what? As we get warmer, we don't want to keep going up and up and then become hyperthermic, right? So as we become warmer, we need to cool back down, right? So we need to have negative feedback to make it turn the other direction. The negative feedback means that we start to sweat. As we start to sweat, we can cool off our skin. And then, I don't know if you guys ever seen, and you can see it easier in people who are more light skinned, right? People who get really, really red when they work out. Reason why is they get red physiologically. When they get red, their body's trying to compensate, because when you're working out, you're contracting those muscles a lot. Your temperature increases. Remember what he just said about contracting the muscle. Side effect is increased body temperature. So what does the body do? Sweat. What else does the body do? It wants to radiate the heat away. So underneath your skin, blood vessels dilate. As blood vessels dilate, it gets closer to the skin, and more red blood cells go through. Because more red blood cells go through that very dilated, closer to the skin region, now we can see the redness appearing. That's why some people who are lighter skin can get flushed when they get warm, is because their body is trying to compensate for that heat by dilating the blood vessels, by sweating, all of that. So then you can negatively impact body temperature, turning it back down. Now, what's going to happen though is this: it's not perfect, right? Once you get to 98.6 again, well, you're still usually going to be a little bit sweaty. Your blood vessels are still going to be slightly dilated. So it'll go down to slightly below 98.6. So then you're going to eventually, though, once it gets to this point, stop sweating, vasoconstrict, right? So then you stop radiating heat away. Then you move back up, right? That's negative feedback. Negative feedback allows us to have deviation up and down. But when we take the average, it allows us to basically be near that set point. Now, negative feedback control is not found just in body temperature. It's found throughout our whole body. It's found in how we release certain enzymes, certain types of hormones as well. Homeostasis allows us to have a lot of this kind of deviation and then coming up, back, and down. This body temperature is just one example of it, right? Just about everything, right, including sex drive and testosterone release, has negative feedback control. Again, here, if you're ever confused about how this works, right, here is how I want to show you how to follow these charts, right? So right here, you go up and then down. Remember, homeostasis doesn't mean that you are in the middle all the time, right? Homeostasis means you're taking the average of the up and the down. So you're right here. What happens if your body temperature gets too high? If it gets too high, you go up here, all right? Your brain sensors are going to activate, causing your blood vessels to dilate. Those blood vessels next to the skin dilate, and you activate sweat glands. The sweat glands allow you to release sweat out into the pores of your skin. And if it's hot, you'll start to evaporate that sweat, cooling off the skin. Now the skin is cold and cool. And because we dilate the blood vessels here, blood is always warm. Now, if you have hyperthermia, like we have here, a little bit warmer than normal, the blood is even more warm. This blood then, warm, coursing blood, cool skin, there's a heat difference now. Heat from your blood vessels can radiate outwards. So then the blood that exits will be much cooler because you've radiated and gotten rid of that body heat. As you get rid of that body heat, you go back downwards towards our normal range. See how that works? If you're cold right here and body temperature decreases, then what can we do, right? The body does a great job when you're a little bit warm. There's a limit to how much it can do when you're cold, right? What it does do is it stops sweating, right? And it vasoconstricts the blood vessels next to your skin. There's a limit though. If you completely vasoconstrict, that means you have no blood flow in that area. That part of the skin will die if there's no blood flow. So we don't want it to get too cold, because if it does get too cold, right, we stop all blood flow going to that region of exposed skin. We call that frostbite, right? So there's a limit to how cold, right, we can how much we can control our body heat when it gets too cold. If it's within our normal range of coolness, then this response is good enough to bring us back down to bring us up towards that 98.6 set point. Now, changes in blood pressure during exercise. So right here, this is the reason why in every kind of situation, if you're watching TV and they're trying to sell you on an exercise regimen, they always tell you that you should see a doctor before exercising, right? The reason why is because there will be a slight increase in blood pressure during exercise. And it kind of makes sense, right? When you're exercising, you're bringing more blood flow to, let's say you're jogging, right? You're bringing more blood flow to the legs and the arms as you're jogging, bringing more blood flow to the heart and to the lungs. That means the heart has to work harder. It has to pump more blood faster. So your blood pressure will therefore increase. And that's a normal response to exercise. But once you stop exercising, it should go back to normal. Now, if you're in good shape and you've exercised for a long period of time, right? So you're a jogger and you've jogged for years and years at a time, you will not see this huge increase in blood pressure during exercise, right? It'll be a small increase, not a big increase. But even with them, there should see a mild increase with exercise. Now, the big thing is this, right? Negative feedback is good. Negative feedback allows us to have homeostasis. Positive feedback is different, right? Usually, positive feedback is caused by a problem, and then you make the problem worse, right? A deviation occurs. The response is to make that deviation greater. Unusual in normal, healthy individuals because it leads us away from homeostasis and can result in death. The only real good example of a good, normal, positive feedback, childbirth, right? Why? Why is that an example of a good one? Right? Here's what happens in childbirth. The uterus and the cervix is an opening to the uterus. The uterus, when the child is being born, the uterus contracts, right? With labor and delivery, the uterus contracts, the baby's head is pushed into the cervix, the opening to the vagina, and then out of the body, right? So as the baby is being pushed, the head hits the cervix. The cervix then dilates. The greater the dilation, the greater the response, causing more uterine contraction. The uterus contracts even more, pushing baby's head and stretching the cervix even greater amount, distending it, allowing the baby's head to go through. At that point, you don't want to stop, right? If you stop, the baby's stuck. So when the uterus and the cervix stretches from the head crowning through the cervix, that increased stretch causes even a greater response in the uterus. The smooth muscle of the uterus contracts with even greater strength, forcing the baby to go through the birth canal, stretching the cervix even more. See what happens? The greater the stretch of the cervix, the greater the contraction strength of the uterus. Eventually, right, the strength of the contraction of the uterus is so great that you are then able to move the baby out of the birth canal, right? That is the only good example of positive feedback in our body. Obviously, I mean, it's not going to happen in males, right? And in females, it doesn't happen a lot, right? Most people in America aren't having 6, 7 kids, or they're like my parents, right? Again, I was born in Indonesia. So my parents had 11 brothers and sisters from my mom. On my dad's side, there was 13. So you can understand then you see a lot more positive feedback, right? Because you have so many childbirths. But that is the only example of a good positive feedback loop. Normally, it's harmful. So let's take an example of when it's harmful, right? Let's say you've got a cut and it's a big cut and you've cut one of your radial arteries, an artery cut, right? What happens when you cut an artery? Normally when you get a cut on your finger and your fingertips, right? If you get a cut on your fingertips, you will bleed continuously. If you cut an artery, you will bleed in pulses, right? And you'll eject a lot of blood out with each pulse. So if you cut an artery, you start bleeding in pulses and a lot of blood exits quickly. What happens then? Well, as a lot of blood exits, your blood pressure drops. As your blood pressure drops, your heart works harder to maintain the blood pressure. So it ejects more blood out because it's working harder. As it ejects more blood out, it means you also then, all right, release more blood out of your cut. And what happens when you eject more blood out? Your blood pressure drops even more. The heart has to push harder, right? And you eject even more blood out. Eventually, you exsanguinate and you bleed out as a response to this, right? Now, another example of this, if is somebody have a blood clot in their body. If you have a blood clot in your legs, what happens? Well, blood that sits has a tendency to clot. So as it sits, right, there's a blood clot in your leg. Now, the blood flow in that region slows down. As the blood flow slows down, blood accumulates in that region, causing more clots. And then as that clot occurs, well, there's more blood sitting in that region above it again, right? And now that blood sits in that region above the clot and it's slowed down, it pools there, causing more clots. That's an example of a positive feedback loop. Usually it is not a good thing to have positive feedback. It leads us further away from our set points. Now, let's talk about terminology right here and quickly discuss this. All right, when we start talking about anatomical positioning, there's an understanding that we need to have, right? That why is simple, right? If I'm talking about this person right here, and this happens in class as well, right? I can say that this is, I can say this is left or right, and then you'll ask me, your left or my left, right? Usually we don't like using these directional terms left and right because of it, right? The directional terms left and right changes based on if I'm looking at you, if you're facing me, or if you're facing away from me. So it's different, right? Instead, we use other ones like, right, medial and lateral. We use inferior, superior, things like that, right, for terminology. But when we have a terminology, we need to understand this basic concept of anatomical position. Anatomical position means the person is standing up, erect. This is the anterior, and this is a big one right here with anatomical positioning, right? The feet together, the palms are upwards. We call this palm facing up, right, as supinated, right? There's a UP, up, in supination, right? So upwards is supine, and I'm just add this here. In anatomical position, palms and there's are supinated, right? In supination.
I didn't get that.
Oh,
could you try
stupid
again?
Siri. Right, in supination, there's a up, right? So just keep in mind, there's an easy way to memorize this, and that is in supination, there's a up in the name, right? That means your body's upwards, and more importantly, your palms are up. Now, there's a big difference, and I do show it on our lab videos on why we want our palms to be up. With our palms up, then the radial and our ulnar bones lie side by side. When your hand and your palms are facing down, we say it's pronated, right? What happens is that your radius and the ulna starts to flip and cross over each other, making it really hard to describe which one is which, right? With your palms up, it's easier to describe. Your radial bone lies on the outside, your ulnar bone lies on the inside, right? So inside and outside, we'll use these terms, medial and lateral. Lateral is towards the lateral aspect of our body. Ears are lateral, whereas your eyes are more medial to your ears. Your nose is then going to be the most medial part, along with part of your mouth. So anything towards the midline of the body relates to it being more medial, right? Then more laterals, closer to the outside. What else, right? Being inferior and superior. Inferior means down towards the feet. Superior is also known as cephalic, right? And it's closer to the head. In terms of proximal, proximal is closer to the main line of the body, right? Distal is further away. Your fingers are distal compared to your elbow, which is more proximal. Now, superficial and deep are a little easier to tell, right? Superficial is like the skin, and then in order to see the muscle, we got to cut through the skin and go deeper. Directional terms. Anterior is the same as ventral. Keep that in mind. These two are used interchangeably throughout the whole book. So you will see certain things called the anterior, right, horn, or sometimes known as a ventral horn. They're used interchangeably. That's the front of the body. Dorsal is the same as posterior, towards the back, right? Again, those two words, posterior and dorsal, completely identical. They can be used interchangeably, right? When we talked about distal being further away from the thorax, proximal being closer. Right, so those are the big kind of anatomical position things you need to know, all right? And usually when we talk about these, it will help us when we start talking about the bones, especially if we talk about which ones of our digits are more lateral, which one's more medial, things like that. Which ones of our bones of the forearms are more lateral, which one's more medial, which ones are the bones of the legs, and even in the palms right here. So we will be using those terms a lot, right? We'll be using these terms a lot when we start talking about muscles as well as nerves. So we kind of got to get used to those these terms. In terms of body parts, right? We'll go through these as we go through the different body parts when we talk about the muscles and the bones, right? The last thing I'll go through is the planes through our body. Right? Now, these planes through the body, it allows us to not literally, but figuratively divide the body. Some of you guys have had an MRI or a CT scan before. CT scans and MRIs are very different than X-rays, like we showed before, right? What you normally get with a CT scan is that they'll show multiple regions, multiple virtual cuts of your body. Some of those cuts may be right down the middle, and then to the side of the middle, but they're along the long axis of our body. That's what we call a sagittal cut. A sagittal cut would be what happens if we divide, and I don't know why they put this, I wish I could turn them around. So right here, a sagittal cut, I'm gonna use this one, would be what happens if I cut on each side right here, right down. If I cut to the side of the midline, right? Then I have a cut to the left, a cut to the right. I cut the body, right, figuratively to left and right sides. Now, when we have sagittal cuts, again, it's along the long axis right here. A median cut is right down the middle. It's a type of sagittal cut, right? Now, a frontal cut cuts me into anterior and posterior. We do frontal or coronal cuts on CT scans of the brain. So then we can see if there's any kind of lesions in different parts of the brain, right? We'll also do sagittal cuts as well of the brain, right? So I'll show you guys, hopefully next week, a picture of those. A transverse or horizontal cut goes right here and allows you to cut your body into superior and inferior halves. So depending on the cut, right, a piece of tissue can look very, very different and based on how we cut it. If we cut this person in half on a coronal cut right here, or a coronal cut right here, it's gonna look very different than if I cut it in a horizontal or transverse cut. Same person, but based on how we're looking at him, right? And based on the cut, that person will look very different on a CT scan. Same thing when we look at, certain kind of histology slides. So here, horizontal cut or transverse cut cuts you into superior and inferior sections. We do this kind of cut on a CT when we're looking at imaging of the abdomen, right? So then we can look at different sections to see if there's an obstruction in that area, to see if there's an infection in certain parts of the abdomen. God forbid, to see if there's a tumor in certain parts of the abdomen, right? Usually that is what we're worried about when we're doing these cuts, is infection or tumors, right? And here's that kind of a better example of the frontal, right, cut right here, or coronal, right? Here's a frontal coronal cut. Here's a sagittal, and here there's like a mid-sagittal cut right here, right down the midline, or median cut. And this is a transverse horizontal cut that cuts you into, and usually that is what we see. We cut it in half, and then we look down on that person. Obviously, this is a literal cut. Normally, when we do a CT scan, it's like a figurative cut. All right, it's almost 1 o'clock already. We won't get a chance to go into chapter 2 today, so I will stop right here. We will start next week on chapter 2, and to finish quickly chapter 2. Any questions? What I'll do is post this on homeostasis, as well as the cuts and anatomical positioning today. So for this weekend, just review chapter 2. We'll go through it, a lot of it, next week. And then we'll next week kind of go through that and post the videos up as well. Oh, and next week we'll have our first Connect assignment. And again, Connect assignments is easy to extend it. So if you can't get your book, right, by next week, that's fine, right? Use these notes that I'm posting up to study, right? Review the PowerPoints. PowerPoints are usually pretty good. So review the PowerPoints as you're watching the videos, especially if there's no book yet, right? That's the best way of us going through it. So then you can at least keep up. Again, if you're having issues with the book, getting it, right? The assignments, usually we can extend it really easily.